leave your comments using the chat function. Again, we are streaming this via Facebook, so any comments left on Facebook will be shared with us by Robin through the Zoom Q&A function, so we can answer those questions as well. Keep in mind, though, that there is a 20-second delay on Facebook, so we'll have to take that into consideration. So thank you.
Thanks, Guillermo. And I want to alert everybody that we are attempting to record tonight so that everybody knows that comments or questions left might leave a permanent record. I say attempt because we're new at this as well, so we think we're hitting the right buttons here along the way. I want to say that this webinar tonight is in response to requests from multiple organizations, workers, and families who are already working to improve health and safety in the meatpacking industry, and in response to emerging urgent concerns on the ground. And I also want to acknowledge that there is work going on this crisis of COVID-19 in multiple industries and in multiple ways. And that includes people pursuing legal strategies, policy changes, doing incredible media work and getting people's stories out publicly, historians giving us better context for understanding what we're living through right now. All of that is important. People are focused on everything from what the future of our food system should look like, what a fair and just system of work would look like, why we need immigration reform, on and on and on. And we can't cover all of that tonight, but I want to encourage people to read some of the excellent reporting, journalism, and writing that is coming out, documenting all of that, and including new research. What we will focus on tonight is the way in which the COVID-19 crisis is posing an emergency for workers. We're going to focus, we have a spotlight on meatpacking tonight, but we know that this same crisis, perhaps at other levels of scale, is facing workers across numerous occupations right now. In meatpacking alone, thousands of workers have been infected. We don't know exactly how many because of the absence of solid testing and tracing. And we've had dozens of fatalities in the meatpacking industry alone already. And I want to acknowledge that what we're talking about tonight is part of a very long history of struggle to make work safe. And this struggle goes on today in the meatpacking industry, but we're confronting the same conflicts and tensions that have confronted workers who have been faced with the question of whether their lives and their safety were worth the investment of employers and society to make their work safe. We are going to be talking a fair amount tonight about guidance that comes from federal agencies. And I want to note as we begin that discussion that out of that long multi-generational struggle for safer workplaces, we passed toward the end of the 20th century landmark, groundbreaking legislation on worker health and safety, including the Mine Safety and Health Act in 1969 and the Occupational Safety and Health Act in 1970. You're going to hear Nancy and me both refer to OSHA several times. Those are incredibly important pieces of legislation. They changed the landscape of expectations for employer obligations to create healthy and safe workplaces, and they've significantly lowered the rates of fatalities and injuries in our workplaces across numerous industries. On the other hand, we know that in recent decades, the strength of the enforcement and the challenge of passing new standards to fit current circumstances has meant that there have been real limitations to how many protections on the ground OSHA is offering. And just to remind folks, there is excellent investigative journalism coming out documenting the roles OSHA has or has not played in the current COVID-19 crisis. So I refer you and highly recommend articles like the one from the New York Times a couple weeks ago. OSHA leaves it to employers to monitor coronavirus at work. Since COVID-19 pandemic began, OSHA acknowledges they've received thousands of complaints at the federal level. Their stated policy fairly consistently has been to refrain from doing on-site inspections. And in addition to that, they've relaxed even some of their existing pre-pandemic enforcement of things like record-keeping rules. Although, due to some significant pressure, some of that is beginning to shift in another direction as we speak in recent days and weeks. So some inspections have started in healthcare facilities first, and this week OSHA is announcing that they may begin to consider on-site inspections in some other areas. What we know as well from history and from recent experience is that recommendations and guidelines do not work the same way that enforceable standards do. And throughout the COVID-19 pandemic, many organizations, unions, and workers have called for an enforceable standard on how employers should respond to COVID-19. OSHA has issued only what they consider to be voluntary guidelines. And the guidelines that we will talk about tonight from the CDC and OSHA are fairly thoughtful and thorough. Many of them have been prepared by experts who have worked on these issues all their lives, but they cannot ultimately protect workers because guidelines that are voluntary and not mandatory don't work. We know that employers often treat even OSHA standards, which are enforceable, simply as suggestions rather than requirements. And in this case, the guidelines from OSHA and the CDC so far have explicitly been presented as unenforceable recommendations. So to explain this to my kids, who I'm of course spending a lot of time as they're out of school with right now, you know, it's the difference between saying it's time for you to unload the dishwasher, or you probably aren't going to get your allowance on Saturday, and saying if you might consider unloading the dishwasher if you think it's feasible. So in a nutshell, those are the guidelines that we have on the table today. I want to turn it over to our guest speaker, and I'm thrilled that she is able to join us tonight at this point to talk about what does work. If we know that recommendations and non-enforceable guidelines don't. Nancy Lesson is retired just last year after working in the field of occupational safety and health for 40 years, first with the Massachusetts Coalition for Occupational Safety and Health, known as MassCOSH, then for the Massachusetts AFL-CIO, and then more recently since 2006 for the United Steelworkers and their Tony Mazzocchi Center on Health and Safety. She has been called back into action on many fronts, now as a result of the pandemic, and we are glad she has been willing to leap back into action because we really need her expertise. And I'm thrilled to have her with us. She has provided very valuable education and training in collaboration with us here at the University of Iowa Labor Center on many occasions in the past decade. And great to have you with us tonight. So
I'm thrilled to be here. Thanks, Jen. It's great to have the band back together, and hello, Iowa. I'm going to first talk a little bit about this document that I think will get sent out to everyone that was put together by the National Council for Occupational Safety and Health. It's a federation of local and statewide groups that bring together unions, worker centers, occupational safety and health professionals, and they work to promote and advocate for safe jobs across the country. What happened here was that about 30 of us got together to write this document, and then it was sent out to many unions, worker centers, and others. And why we did this was that we kept seeing these choices being presented. And this is a headline from the Washington Post last week or the week before, said, as Iowa reopens, workers are being forced to choose between a paycheck and their health. A wise young Marine once taught me that when you're faced with two bad choices, take the third. And this document really points the way to that third choice. making jobs and workplaces safe, ensuring living, saving wages and benefits for all, providing care and assistance and protection for those who are not able to work. And the focus is on what can happen at the state and local level, because the feds have been so missing in action that that's where we think a lot really needs to happen. The frame of the document is about the importance of not returning to normal or the status quo, but laying out a vision and a pathway to address institutional and structural inequities that helped get us here in the first place. The document says, while the virus doesn't discriminate, this country's history of institutional racism and discriminatory policies has a huge impact on who lives and who dies in this pandemic. So we identified 5 areas that really needed work. And I'm just going to highlight a few of the things that we put in each of these areas. And these are things that we think should happen at state and local level, and state and local level activists can help bring them about. The first that we say under the effective and stringent health and safety protections is to enact measures that ensure the health and safety of workers based on science, and a bunch of the things that we're going to go through tonight pick up on that. For everything that we suggest, we have resources. Another in that section is enact a state infectious disease preparedness, response, and control plan for all workers. The feds are not doing it, so we're saying let's go state by state and get our states to do that. We also have in this section enact strong whistleblower protections on the state level, and an appendix to this document has laid out what a good whistleblower protection standard on a state level would look like. And we also say, along with enacting vigorous protection against employers who retaliate based on immigration status. Other things in this section, we have strengthen workers' rights to refuse dangerous work when adequate safety protections are not provided. Prohibit employers from enacting or continuing incentives or bonuses for not using sick time, for reporting to work for a certain number of days or weeks in a row, other kinds of policies that discourage workers from being absent from work and utilizing their sick time. And we also have one mandate that employers discontinue production quotas because these can have a real effect on how viral transmission happens. And we also say rules that limit workers' time for hand washing and proper sanitation have to be eliminated. In the second section about a planned, detailed, meaningful system for screening and testing, we say to ensure that there are worker and union-centered representation. Actually, for that one, that's, hang on for a second. For that one, we talk about workers need to have access to free, accessible, reliable, rapid COVID-19 testing to take place on paid time. Investigate outbreaks or clusters of COVID-19 in workplaces and establish procedures for closing workplaces if there are infections and outbreaks, and all of that has to be with the input from workers and union representatives. And we also in this section say incorporate collection of information about occupation and industry and employment at the time of disease onset, as well as race and ethnicity in the public health surveillance system. In terms of guaranteed job protection and just compensation, we have the right to paid job protected sick and family leave. And that's for everybody, public workers, private workers, independent contractors, undocumented workers. We also have ensure that workers who have been exposed in a close way with a coworker or at home have the right to quarantine with pay for 14 days. And we also have mandate workers' compensation benefits for all workers who become infected with COVID-19 after a workplace exposure. And we have an appendix that has a model workers' compensation language that's, can be very useful. In the next section about inclusion and respect for meaningful worker voice, any kind of task force that a state has or a locality has needs to have worker and union representation. We have also talked about ensuring that workplaces without a collective bargaining agreement can authorize a person affiliated with a union or a community organization as their personal representative, as well as to act on their behalf as a walk-around representative for any kind of state or local health or safety inspection. And in the last section, which is about prioritizing equity and ending health and economic disparities, we say to mandate and enforce a state-based living and saving wage that will sustain healthy, non-precarious standard of living and make the term low-wage worker obsolete. And we also ask that state labor law be amended to address inequities, and that would include the need to cover domestic workers, agricultural workers, restaurant workers. What sets this document apart from many other of the blueprints that we've seen is that it provides good science on workplace protections, good policies to address structural inequities, and both concrete and visionary ways to use this moment to build the movement and power to transform this country and set a new path for workplace health and safety and for racial, social, and economic justice. So you will get this document, and I hope you can use it in ways that will be useful for you. Take out of it what you need and want, and go for it, because it's written for you. All right, next slide. Oops, can I? Okay, so with the lack of real enforceable federal protections at this time, it's time for workers to take action. And just to emphasize, and next slide, to emphasize, there are laws on the books at the federal level. OSHA has a general duty clause that says employers have to provide all workers with a safe workplace. Under OSHA, there's a right to refuse unsafe work. It is incredibly weak. There's a right to concerted activity, and that's under the National Labor Relations Act, and it covers both union and non-union workers. And if you are working together collectively, that means two or more, you have protected rights to do many things. And so that's a good thing. The bad thing is that these laws are not reliable, and they can act very, very slowly. But it's good to know that you have those protections if you need them. If you have to file complaints, please do so, but don't wait on just that to move forward. There's many other things, and that's what we're going to talk about. There are whistleblower protections under OSHA, again, incredibly weak. And if you have a union, use your contract, use your grievance procedure. Some things may take longer times, but there's sometimes ways that you can exert power to kind of instantly negotiate the terms of workplace health and safety that you need. So these are all things that you can use, but we really want to be looking at worker and union action supported by communities and allies in public office and others to really move things in the way they need, which is really immediately. We're dealing with an imminent danger that can kill. And so working through things quickly is what we'd like to do. Next slide. So this shows the core principles of health and safety. And in every workplace, there are hazards, and we use something called the hierarchy of controls to help us judge what's most effective. It starts with elimination. If you can get rid of the hazard, get it out of there. If you can substitute a safe chemical for one that causes cancer, do that. After that is engineering control, something that will keep the hazard from coming in contact with the worker. Then there are administrative controls like training and procedures. Last on the list is personal protective equipment, the least effective way to address a hazard. When we're dealing with COVID-19, a lot of what we're looking at right now is going to be in engineering controls, administrative controls, and there are some very important personal protective equipment pieces that come into play here. But our goal here is to really change the workplace to make the workplace safer, not have to have the worker contort to try to do all of this. We want to slow down the line. We want testing for workers. We want better ventilation, and we'll be talking about that. Next slide. All right, so there are some important documents to look at. On April 22nd, the CDC report looked at the meatpacking facility in Sioux Falls, the Smithville plant, made a lot of good recommendations, but there's many weasel words in there. It says, if feasible, if possible. All things are possible to make workplaces safer, and that's where we need to come in to really do the enforcement of what needs to happen. On April 26th, OSHA and the CDC, Centers for Disease Control, came out with interim guidance. It's again guidance. There's some things that are good in there. It doesn't go far enough. And this week, the CDC has a toolkit for meat and poultry processing facilities, which is also really good to look at. And all of these things can be guidance for what workers and unions decide they want to do. Next slide. So this is basic. If we're now going to talk about COVID-19 and how it's spread. The droplets from coughing, sneezing, these are the large droplets that come out of your mouth. If you are infected, they are infectious. They generally drop out because they're heavy. And so that's why we end up with the recommendation for the cloth face covering. And we'll talk about this, but the cloth face covering is not to protect you from other people. It's to protect other people from you and the droplets that might be coming out of you. Those droplets are seen to not travel very far. Thus, the recommendation for 6 feet between people. I'm going to go now to the one that says possibly by touching surfaces or objects, those heavy droplets can drop onto a surface, and then somebody can touch a surface and then touch their eye, their nose, their mouth, and it can get in them. Thus, the recommendation on the cleaning and disinfecting. What is not talked about nearly enough are the airborne microdroplets. And these come out when people are talking and breathing, as well as singing or sneezing or coughing. They can travel for long distances, much farther than 6 feet, and they can stay like a cloud in the air. And so a lot of the protection factors that people have talked about, the 6 feet and the face covering, the cleaning, that's all good. It is not enough. And attention needs to be paid to these microdroplets. The kind of protections needed from them would be everything from engineering controls, ventilation, as well as more protective respirators. And we will talk about that. Something to keep in mind is that people without symptoms can spread this virus. They talk about between, I've seen it between 20% and 80%. Usually people say 20% to 50% of people with this virus do not have symptoms. And so in general, everyone has to be treated as if they may have the virus, and the protective measures have to be for everyone. We're still learning about the virus. A lot of research is going on, but there are many things we know, And these three major routes of transmission, the large respiratory droplets, the micro droplets, and what's called fomites, the dropping out and getting on surfaces, we have to be paying attention to. Next slide.
So I'm going to jump into highlighting some of what is said in the existing CDC and OSHA guidance. And the first thing the CDC has to say is that they note there are some distinctive factors that exaggerate the hazard of an infectious airborne illness in meat and poultry processing. Those factors include close working next to other people for long periods of time, long shifts with prolonged contact, and shared spaces and shared transportation, even when people aren't on the production line, when we'll talk about some of those shared spaces. So I just want to note that those may indeed be distinctive factors, and they do not mean that it is inevitable that outbreaks should be occurring in this industry. Because as Nancy said, these are all factors that can be changed, that can be remediated. And I also want to add that one of the discussions that's going on broadly among many union leaders is, how is this forcing us to acknowledge hazards that were there before we had a pandemic? And we were probably exposing people to illnesses that they shouldn't have been exposed to because of these factors before. Close distances with sharp objects and too long work shifts are not healthy, even when we're not in a pandemic time. And what do we need to do to begin adjusting the workplace so that it truly can be safe and healthy in the long term? The CDC recommends that each plant must, or should, I should say, we're going to say must, should have a COVID-19 assessment and control plan. And that means designating somebody who's a qualified coordinator, somebody who has health and safety expertise, and that all workers should be given information on how to contact this person, who they are. They recommend using the hierarchy of controls, which Nancy introduced a bit ago, and that plants should be doing regular worksite assessments, including showing that they have a plan for testing and contact tracing, and we know that that's one of the missing ingredients or significant missing components as people are beginning to go back to work, that we don't have access to comprehensive testing and contact tracing plans yet. So in practice, and we're going to jump back and forth here between what does the CDC say and what are we hearing or observing, or what do we have to begin considering on the ground in trying to apply this guidance. In practice, as plants are reopening or maybe didn't close but are trying to maintain or ramp production back up from reduced levels, many questions are being posed from workers on the ground, including, so if plants are taking that step of appointing a qualified workplace coordinator, who has communication with them, who's been told who they are? I think an additional question is, are they truly qualified? We should verify that. Who can verify statements that are often being made in response to questions that a particular plant has complied with all of the guidance? How do we have independent third party and worker verification that that's the case? And that can only happen, of course, if workers are being trained and prepared to monitor conditions and to know what to look for. And that's one of the goals of our webinar tonight, is to make sure people who are in close contact with workers know how to prepare workers to monitor for best practices. Who is involved? And to go back to Nancy's point about the core principle of there is no healthy or safe workplace unless worker voices are part of decision making. And of course, what are local recommendations and plans for testing? If we don't have that, we don't have a long-term solution to an infectious illness. I'm going to turn it back to Nancy to comment on CDC's suggestions that ventilation also needs to improve.
So CDC says it's a suggestion, and we're saying, let's take this into our hands and make it happen. We know lots about ventilation. This picture shows the big droplets that are falling out pretty close, right? And then those little micro droplets that carry in the air and can go far. good ventilation systems can prevent this from happening. The American Society of Heating, Refrigeration, and Air Conditioning Engineers, it's called ASHRAE. They've been doing this for years. They've got standards and guidelines about airflow and HEPA filters. This is not rocket science, but it does cost money. And so, you know, what we generally say in health and safety is, health and safety is not primarily a medical or a technical problem, although there are medical and technical issues. It's not primarily a legal problem, although there are legal issues. It's a power problem. And our job now more than ever is to build our power so that we can change the kinds of things that are present in our workplace that are literally killing us.
And we're going to pause throughout briefly to respond to maybe one or two questions or comments. And I know Guillermo's been taking a look to see if any of those have popped up.
Yes, so we do have two questions. The first one is asking, will we make the documents that Nancy was referring to earlier in her presentation available?
Yes. So while Nancy is speaking next, I will attempt to put a link in the chat if folks want to get the link right away to the National COSH report. And I highly recommend everything on their website, not just that new report, but that new report is timely and provides exactly the framework many of us are looking for. And we will also send a follow-up email. So if you had registered and we have your email address now, the follow-up email will contain links to the guidance documents and the reports that we're referencing during the webcast.
Wonderful. The next question is for Nancy. She's just asking if you can repeat the name of the Air Quality Association that you referred to.
It's the American Society of Heating, Refrigeration, and Air Conditioning Engineers. It's abbreviated ASHRAE. You can Google ASHRAE. It's ASHRAE. And you can get their standards and their guidance and everything that's needed to, you know, look at a ventilation system and say what needs to happen.
Okay, so we just got one other in. Let's see. So ammonia refrigeration systems do not follow the same technical rules as normal HVAC systems follow. IIAR standards apply, not ASHRAE standards. How can we get the right experts together?
There are fabulous folks that really know this stuff. And when you're dealing with an ammonia, you know, there are many different things. I'm going to say through probably the labor center there and the connections to National COSH and unions. The folks are there to do this, and certain parts of a workplace may do well with the ASHRAE. Others, you want to look at how you're dealing with, you know, other functions. But in terms of what needs to happen, I think the experts are there. Ask for them, and they will be they will be there for you. So go through. You can go through your union or the labor center, and I'm sure other places as well.
Great, thank you. So we're going to keep going because we have quite a lot to cover, and we'll come back to. We'll pause again for questions in a couple minutes.
All right, so I'm going to talk a little bit about this distance thing where CDC says workers should be at least 6 feet apart. You know, we would prefer it be more than that if possible, unless there's good ventilation or good personal protective equipment. But that means, you know, changes in the way production is happening. So in this first picture, the top picture, that isn't what you should see. You should not see workers being face to face across from each other. Everything should be the 6 foot distance with nobody facing each other. And it generally means that things are going to slow down and not as much is going to get produced, but it's going to save lives. Next slide. There we go. All right, so modifying workstations with barriers to separate, but even with the barriers, there really needs to be at least that 6 feet between people. And there's some real questions about what meatpacking plants are doing right now, hanging these little sheets of plastic between people. There's really no evidence that this is doing anything. So whatever is done really should have some science behind it. And that's where the worker and union participation has to be right in there. Right, next. And we even have the CDC saying changes in production practice may be necessary in order to maintain appropriate distances among workers. And you can see in that picture, that is not what anything should look like right now. Next slide. In practice, effective distancing, how we're going to do this, all of this needs input from those on the shop floor who are doing it. Many of the recommendations talk about areas where workers are not able to maintain 6-foot radius. Well, if that's the case, what are we going to do? What kind of protection needs to happen? Or can we really separate things? Again, workers really needing to identify which jobs, which times, which areas where the distancing measures are needed and getting them in there. Next slide. And once again, it's not just on the line that we're talking about. It is going to the restroom, going to the lunchroom, moving in between. Everyone needs to be 6-foot distance, so things are not going to be as quickly and as rapidly as they have in the past, and that's the deal. This also implicates meal and break rooms, and we talk about, adding extra, or CDC talks about adding extra rooms and such for that, and touch-free time clocks. And we would say touch-free doors and touch-free bathroom faucets and paper towel dispensers. More meal areas, more microwaves, more lunchbox shelving. But again, if you're staying 6 feet apart, lunch breaks may need to be longer to accommodate all this. Next slide. Questions, comments?
Yes, so we do have one additional question related to masks, and it's simply, do masks stop the micro droplets?
Hold that thought, because we're going to go there in just a few more slides. So we will get there, and then if there's a question after that, we'll make sure that there's a space for that.
Yeah, that's coming right up. So CDC also recommends staggering or dividing the workforce into multiple shifts. So that goes to the point about how do you create the distance you need? Well, you need to make some significant changes in the production process and in the number of people who are in the plant at any given time, and in some cases the line speed. And I want to acknowledge that slowing the line speed in order to improve safety is a battle that unions have been fighting for years on every front. And the CDC recommends that one other way to do this is to group workers together so that they are not rotating among different shifts or different departments and being exposed to a large number of people, but setting up teams essentially who might work together on a consistent basis and only come into contact with a smaller number. CDC also raises the real and challenging issue that transportation to work is necessary, and many people share rides to and from work, and particularly in states like Iowa, where there's very little public transportation. We're talking about people sharing cars or vans in most cases. And their recommendation is that we start limiting the number of passengers per vehicle, that everybody is wearing a face covering if they're in a shared vehicle with somebody else. and that the company allows time for, if people are in a company-sponsored rideshare, to clean and disinfect vehicle surfaces. Now, there is no recommendation coming forth from the CDC on how much responsibility employers should take for this. But nonetheless, the suggestion that the company might allow time for rideshare drivers to clean and disinfect a vehicle suggests that there is an implication of responsibility here. So I think it raises the question in practice, how can workers, unions, and community members begin to address this problem? What can employers be required to invest in safe transportation if they want workers who have few other options to get to work safely and home safely? So potentially, I mean, many different organizations are floating different ideas, including local transportation teams, to begin brainstorming solutions. And workers and community members will have to play key roles if we are going to attempt to solve this part of the problem. Are there questions and comments at this point?
Yes, we have two additional questions. The first is, how do we validate when employers say they're doing these things?
We're going to be talking about very soon the need for the voice of workers and union reps to be right there, out there, because they're the ones that know. And so one of the things we'll talk about is creating worker or local union safety committees who are going to be monitoring this stuff and then getting in touch with allies in the community and others if things aren't right. So again, we'll talk about that. And Jen, you may have other thoughts about this. So.
Yep, that's exactly right. The only people who know what's happening in their shift in their department on a daily basis are the workers themselves. So it has to be their eyes and ears are what verifies what's happening or not happening.
The next question we have is, what are the laws or rights regarding linguistic diversity? What is the appropriate way to go about addressing the need for language interpreters?
No, I'll quickly say in some OSHA standards, it's written in. OSHA has a standard about informing people about the hazardous substances they're exposed to, basically meaning chemicals, and training has to be in the languages of the workforce. In a lot of the guidance from CDC, they also talk about signage and other things have to be in the language of the workforce. But again, this is something that will have to be ensured by the people on the ground. And when it isn't, that's when actions need to take place to call it out and make sure it's being done.
Yeah, and we will come back to that briefly before the end as well. So I want to keep that question on the front burner. So the CDC also talks about trying to minimize the number of workers who are at work. This is a recommendation that applies not just to meatpacking, of course, but if we go back to the hierarchy of controls, the only way to eliminate hazardous exposure like COVID-19 is to get people out of the workplace physically. It's why we've seen, in some cases, so much work moving to home where that's possible. The guidance here is to prioritize critical tasks. I want to note that though it does not appear explicitly in the meatpacking part of the CDC guidance, there of course are also recommendations that people with underlying health conditions who may be at special risk should be removed from the workplace. And CDC specifically says that employers should review their leave policies and adjust attendance policies in a way that encourages and allows sick workers to stay home, not to be at work. So that means not implementing discipline, or what are sometimes called attendance points if you miss a day of work, if it's a COVID-related absence. And beyond that, unions and workers in some cases have fought for and won additional bonus pay or hazard pay. In some cases, employers are offering it because they are concerned workers will not show up to work without it. But it should not be linked to attendance. In other words, workers should not be fearing or that they will risk losing that bonus pay at this time if they stay home because they have symptoms or because they've been exposed. Now the key here is communication, and this goes back to the language question that somebody just asked. How are these policies being communicated? And are all employees aware? Do they understand? And I also want to note that there is contradictory guidance coming out from the CDC that reversed some of its earlier recommendations. In April, they are now saying that exposed workers without symptoms can be permitted to keep working, which of course undermines many of these other recommendations. And I want to shift now to briefly noting that in practice, this question of can workers stay home when sick or exposed is linked to many other factors, not just what a policy might say on paper. Everything from can they afford to? Will they still be paid when they're home for a period of time? Now, I broke these things down into two categories because I know there is a great amount of confusion about what rights and abilities workers have not to go to work. There are some minimal legal protections that might apply, and I want to start with the Americans with Disabilities Act, because for people with underlying serious health conditions that increase their risk of complications to COVID-19, one option might be, in some cases, requesting a reasonable accommodation under the Americans with Disabilities Act that can include not being at work for a period of time, a leave that might not otherwise have been granted. We have federal laws like the Family Medical Leave Act on the books. Unfortunately, it only applies in this context once someone has already become sick. We also had emergency legislation passed by Congress, that's FFRCA, sorry for all the acronyms here, Families First, many people are calling it, Coronavirus Relief Act. And that created some additional leave protections, paid sick leave and paid leave for workers to stay home to care for children during COVID-19, but it excluded employers who have 500 or more employees. And that means that in the meatpacking industry, almost no workers are covered by that new provision, unfortunately. Unemployment benefits, of course, are expanded in this context again, because on the hierarchy of controls, the safest thing we can do for workers and for public health, frankly, is get people out of the workplace and make sure they still have income while they're out of the workplace right now. So unemployment benefits are expanded, but of course eligibility for them varies depending on each worker's situation. Now, on the other hand, by union contract or company policy, there may be a range of ways that workers can be off work, sometimes with pay or sometimes without pay. There are reports from unions and workers and family members that companies are adopting a range of policies in this context, and I just want to emphasize every company has approached it slightly differently. In some cases, it's been through an agreement with the union, and some companies are offering paid leave for a limited length of time for COVID-related absences. Some are telling people they can use their vacation. Many plants have in place a short-term disability plan, which replaces only a percentage of workers' wages, and in some cases, they have agreed to increase that percentage for COVID-19 related absences or shutdown periods, which we've seen many of in the recent past. All of this, all of these questions are linked together. Can workers depend on their health insurance continuing or not? Are their absences excused or not if they're COVID related? And of course, are these leave policies being communicated clearly in a way that workers understand? So I think one of the repeated themes that we're hearing from workers on the ground is that there remains a great deal of confusion about the process for requesting leave and whether people's pay will continue at what level, and whether there will be negative consequences for absences. And that really is linked to the reality that many workers have been conditioned to expect that any absence for any reason will come along with negative consequences. And the shift that we've had to go through on a dime to protect worker and public health in this context has been incredibly difficult. And it is linked to the question Nancy raised earlier about what does this tell us about permanent changes that we need to make in our work cultures and our employment relationships going forward. Because the punitive approach that we had in place was negatively affecting people's health and safety in the past. Now we can see it very visibly. There's a lot on this slide and a lot of individual variations on this theme. And so I'm going to move ahead because we can't talk about it all now, but I just want to note that if people have questions on a particular policy or a particular piece of the federal or state law, we'd be happy to follow up on those. And mostly just to say that it's very important for people to try to find out and where possible, get written copies of what the local plant and corporate policies are so that it's clear. Okay.
Oh, I'm just going to say a word about this. Blame the worker has been one of the oldest tricks in the boss's toolkit there. And we've seen pre-COVID all kinds of ways that workers get blamed. Right now, some things are coming to the fore. Retaliation for raising concerns or filing complaints. We've seen that a whole lot with healthcare workers, nurses, and doctors who have called out the lack of equipment that they need have been fired. Many headlines for that. And then there's something else that I wanted to flag that's going on. This is Alex Azar, the Secretary of Health and Human Services, said the other day, unfortunately, the American population is a very diverse. It is a population with significantly unhealthy comorbidities that do make individuals in our communities, in particular African-American minority communities, particularly at risk here because of significant underlying disease. It was stated in an op-ed in the Boston Globe the other day. The title of that was called "The Link Between Coronavirus Deaths and Those French Fries." What is happening here is that they're trying to say it's all about the people, it's not about the place, it's not about the workplace. And what I want to say is it is all about the workplace, and we have to fight against all of this. It's the workers' fault because they eat too many French fries or they live too close together, or whatever they're going to come up with, because in fact it is the workplace, and we have to turn all attention on making workplaces safe.
Thanks, Nancy. And I want to pick up on that because it's linked to the slide before this that we just left. So we have workers' compensation laws in place in every state in the country that require that if a worker suffers a workplace injury, there are benefits available to them. Their health care related to it is covered, and the partial wage replacement is covered. And if they die from a workplace exposure or injury, benefits are available to their families. So this question of, is it an individual's fault that they contracted the virus versus was it contracted in the course of their employment, is a critical one for determining whether workers will be eligible for, and whether those benefits that should be available will be going forward. So the CDC also emphasizes that it's the employer's responsibility to educate and train workers and supervisors about COVID-19 risks. And there's fairly detailed guidance in the CDC and OSHA materials that encourages employers to make sure the materials are easy to understand in workers' preferred languages, to go back to the question that someone asked a little bit ago, at appropriate literacy levels. In other words, the emphasis is on, is the information received by the audience, in this case, the frontline workers who need to understand it in order to keep themselves safe. And the CDC emphasizes that any written materials or written or graphic postings should be in all languages that are spoken in the plant. CDC has just a couple of brief documents that they have made available in about 15 or 20 different languages, and those are on the CDC website. But again, not all of the information is readily available And so the guidance, I think, really suggests that it is the employer's responsibility to also translate any additional information that's needed and any local plant policies that workers need to know on all of these topics that we've covered tonight.
So I'm going to talk a little bit about this cleaning and disinfecting because of those fomites. That's the large droplets that fall on things. And CDC recommends to regularly clean and disinfect tools. I would say regularly needs to be defined by the workers doing the job. Clean and disinfect barriers, workspaces, break rooms, at least once per shift. That at least, again, is something that depends on how many people in the room. And I think the workers need to be absolutely involved in all of these decisions. Clean and disinfect handrails and push bars and handles. And this is where we would say, go to a automatic door system if you can, in places where it can, so you're not touching anything. Next slide. Clean and disinfect safely. So the OSHA's hazard communication standard says that whoever's doing this, they have to be trained, and it has to be in the language that the worker understands. There needs to be adequate time now allotted for cleaning and disinfection. That may slow things down. If the various cleaning products need personal protective equipment, it has to be provided according to the manufacturer's instructions. An EPA List N, that gives the list of what kinds of products are going to be effective in killing SARS-CoV-2, which is the virus that causes COVID-19. There is a great fact sheet that I'm going to get to Jen to send out, and it talks about all of the disinfectants that are approved for that, but some of them cause asthma. Some of them cause other toxic effects. So there's a list of which cleaning products both kill SARS-CoV-2 and won't be harmful for the people dealing with these cleaning agents or the people that's around breathing stuff in. Next slide. CDC talks about screening and monitoring workers, and there have to be policies and procedures developed in conjunction with state and local health officials, occupational medicine professionals, and so they look at screening prior to coming into the workplace, and a little thing that people can fill out if they've had certain symptoms, and then the temperature check. What I want to say about that is, again, re-emphasize that many people can have this virus and not have any symptoms at all. Many people can have this virus and have no fever. So just because you get in the workplace, because you've filled out your little questionnaire and your temperature is fine, doesn't mean you're fine. And so we really need to pay attention to all of these controls that are meant to keep you safe in the face of a situation where people may be in the workplace who are infected.
And the CDC also says that if workers do become symptomatic or are tested, known to be positive, they should be immediately separated from others, and that people managing sick workers should be themselves protected. And I want to pause on the third point here, that coworkers should be informed of possible exposure. This has proven to be a very contentious issue. There are ways to maintain confidentiality of the individual while still making sure that anybody exposed knows that there's been a possible exposure. And this is where, ideally, I mean, what we're seeing in other parts of the world and other countries is that when you get to a point of more significant control of the virus, it's because you have effective testing and contact tracing. And in a large workplace that in some cases is the size of a small city, you need that, and that information has to be consistently shared with employees who might have been exposed. In practice, so far there's a wide variation in how individual employers are handling this. So how and when do positive cases get reported to employees? And secondarily, how and when are positive known cases getting reported to public health officials? we have a wide range of practices in place right now. I want to emphasize that we've seen, I think, multiple examples that bear out the fact that people will get this information only when they have the power to demand it in some cases. So I want to remind folks that one right that unions have under labor law, under National Labor Relations Act, is to request information that's relevant to their ability to enforce the contract. That includes this type of information. So I just heard a steelworker local leader, Brad Grieve, earlier today on a different webinar talk about the positive known cases in their very, very large facility in the Quad Cities. And he knows exactly how many there have been because they have a solid agreement with management about how that information is going to be shared immediately and what the practice is to follow up on it each time. In the absence of a consistent mandate or consistent practice across all employers, again, this is something that is going to be in the short term up to workers, unions, and community members to figure out how to take this matter into our own hands in many cases and teach workers how to track their own exposures, share their own information where necessary, while they're in the process of building the power they need to require that it gets shared with them consistently by management. Are there questions and comments at this point?
We do have a few questions. Are there any recommendations for people leaving work, such as changing their clothes before going home or things like that?
There are, depending on what you are, working with and exposed to, and I know in healthcare, there's a lot of taking off the kind of protective garb that they have. But in general, I think thinking about, if there are coveralls that, you can take off and the employer deals with them, that would be great. But in terms of, are you going to get some drop of virus on you and then carry it home? And by the time you get home, there's a lot of questions about how long is that virus going to live on a piece of clothing? They've done some studies about, it can live for a couple days on metal and a day on cardboard. People are thinking that it's just not going to live that long on clothes. But, what I would say is think about what you think, what workers think would make them, feel the best. And if it's getting some kind of, overall that they can leave at work and that gets laundered at work, then go for it.
Okay, we have 3 more questions. Do we have time for all 3?
Let's go for it.
Okay, so do we have any suggestions for dealing with companies that are finding after their investigations that employees are getting the virus from outside of the plant?
I'm unclear on how an employer would know that.
Yeah, so it's probably a good idea that, if employees feel like they're at risk, to make sure that they're, making notes, keeping notes about what it is they feel that's putting them at risk. That way at least there's some record to help, point back to the fact that these, they face these risks at work as opposed to outside of work.
I mean, it's not different from many other things. People can get asthma from, childhood, or they can get asthma from a cleaning chemical, right? And so understanding if there's a work-related component, and what we would say is generally if there are people in the workplace who have tested positive, then it's in the workplace. If an employer says, well, there's no proof that you got it here, that's where we, one of the recommendations in that national COSH document under the workers' compensation is basically says, if somebody has had, close contact with somebody else that, has the virus, then we are going to say conclusively presume that it comes from the workplace, end of story. But again, we're going to have to fight for this.
Next question. What is the policy in cases where a worker was told to stay home because a family member was tested positive for COVID-19 and their workplace puts them on unpaid leave?
Yeah,
I think, go ahead, Jen.
Yeah, no, I was just going to say, again, unfortunately, unless there's a union negotiated or a company policy about pay being part of a COVID-19 related leave right now, there is no state or federal law that will automatically require an employer to provide that pay. So again, I would also, though, again, urge people in each situation to find out what the company policy is and whether it's actually being followed. Because some of the, I think, sometimes the gap between what companies say they have offered and whether employees got the communication about what was available is still fairly large.
And I'll also say, while there may not be a state law right now, that doesn't mean there can't be a state law.
That's right. And the paid leave offered in the Families First emergency piece of congressional legislation is temporary, but it also represents the first time we've had a federal mandate of any kind for paid leave that employers must offer. And it was modeled on legislation that advocates have been reintroducing in Congress year after year after year for decades that could be a permanent policy to provide paid sick leave for a range of circumstances for all workers. There's no reason we can't have such a law. And in both countries.
Thank you. Bye,
All right, there's two more. So the next one is, I'm sorry, go ahead.
As I said, let's maybe hold the remaining two to make sure that we get to the discussion of health and safety committees, and then hopefully we can jump back to them toward the end.
All right, so now this is the section on personal protective equipment. CDC has guidelines, says employers should use video or in-person visual demonstration to train workers how to properly put on and take off and clean and maintain personal protective equipment. Talking about hand hygiene, a lot of washing hands. If you have gloves, care in how to take those off, put those on without getting any of the infected stuff that might be there on your hands. Personal protective equipment must not be taken home. And I'm going to add, all of this training needs to happen in the languages of the workforce. Next slide. So here we're now going to go to the question of what's the difference between a respirator and the cloth coverings. Personal protective equipment like N95s protect the person who's wearing it from the virus getting in, or the germs getting in, or the chemicals getting in, or whatever it is. The cloth coverings, the cloth face masks or face coverings, are what's called source control. That is to protect others from you. If you have the virus, that's going to collect those big droplets inside that cloth barrier. It is not, there's a lot of leakage that can come around it, so it is not going to be foolproof in protecting you from the particles that are in the air. There is some suggestion now, some research that says it may do a little in terms of, having some protection for some of the kinds of large droplets, but it is not primarily for that. It is not designed for that, and it is not called personal protective equipment. All right, next slide. So this shows you what is considered personal protective equipment. A surgical mask can protect from, it generally protects the patient, but it's made with a substance that can be stronger than the cloth mask, but it needs to be right now. There aren't enough surgical masks in healthcare, so they're saying people should not be wearing these. They should be wearing the cloth coverings until there's enough in healthcare. The next picture is an N95 respirator. This is a true respirator with a tight fit. Definitely personal protective equipment. The last one is what's called an elastomeric face piece respirator. There's also a powered air purified respirator. These are actual real things that are going to protect you. The surgical mask, while better than a cloth mask because of what it's made out of, is not airtight. And is not going to protect also from the tiny droplets. The two things on this page, the N95, the elastomeric, they will provide that protection. I also want to say that while there's not enough of these right now for healthcare workers, there should have been. And if we could enact the Defense Production Act on a national level, we could get enough of these, not just for healthcare workers, but for everybody in the industries where they need them. Next slide. Again, this is reiterating what personal protective equipment versus source control and the N95, and you can put a face shield on that. That would make it more protective. Less protective is the surgical mask with the face shield, and the least protective is the cloth or paper mask. Again, primarily source control, and the face shield, again, does not make a tight shield for those little airborne, the aerosol droplets. Next slide. So CDC is saying what is needed, and they talk about the cloth face covering, and again, it is not PPE, fits over the nose and mouth. Multiple layers of fabric make it you know, a little bit more protective, should be laundered daily, replace if wet or contaminated, avoid really touching it, and face shields will be more protective. But again, if we're talking about protection from the micro droplets, the aerosols, this is not going to do it. And that's why we talk about other things like ventilation, other things like some barriers may provide, depending on what they are. And the issue of maybe N95s, but we're going to have to get more made before that can become a reality. And again, that's you know, if we can build the power, we can do that.
So there has been a theme, a clear theme throughout this discussion already, that in practice, any of the guidelines that we've talked about tonight, and I just want to note that in the written documents themselves, there is even greater detail, in particular in the report that CDC did on the Smithfield plant about recommendations and best practices and better practices. But in practice, none of these guidelines become enforceable in our current moment unless workers' unions and communities gain the ability and the power to enforce them. So I'm going to turn it back to Nancy as we turn the corner here to wrap up, to remind us of what do we know about what does work, because it has worked in the past, and what lessons can we apply to our current moment? What existing models can we look to? And then end our discussion tonight on looking ahead, what experiments are already underway in the present, right here in Iowa, right here in the Midwest, and what next steps can we take with the information that we've got under our belts now.
So we're going to say every single workplace needs to have some kind of worker-led health and safety committee. Typically, effective worker or local union health and safety committees are going to investigate conditions, they're going to communicate with workers and union leadership if there's a union on health and safety matters. They're going to develop and recommend strategies and actions. And you do not need any law or contract language to have a worker-led or local union-led health and safety committee, and community groups can assist in many different ways. Next slide. So who serves on this? Representatives of the worker or union. All right, there we go. Who serves is, we look for workers from some different shifts and departments and language groups, and it can be appointed or elected in a union workplace or volunteers if there's no union in place. The functions of the committee, again, identify current and potential hazards, identify appropriate measures that would be needed to control or eliminate the hazards, evaluate the effectiveness of the control measures in place, communicate with the workforce of the membership, identify effective strategies and actions when things aren't right, and build worker or member involvement in these health and safety efforts, because it's going to come down to worker and union power. Next slide. Examples of activities that these committees can undertake: they can survey or interview workers about what's going on. And again, these are general things. It can all be made specific to COVID-19. If that's the focus right now, survey or interview workers about their issues, their concerns, conduct hazard mapping. Sorry about that. Let me get back to, all right. I am just waiting for the slides to come back there, and that is not them. So
you were just running through
right,
committees typically when they're effective.
Okay, here we go. All right, I just got my slides back. So hazard mapping to identify where are all the places where COVID-19 exposure can happen and what do we need to do about it. Identify and communicate with, you know, and I'm skipping over some things, but if there are unions in the area, community-based organizations, other allies who may be able to support specific campaigns or demands to improve health and safety in a particular workplace. All right, next slide. Again, possible committee activities. You want to track workers or members' experience with testing, exposure, quarantine, isolation, return to work. You know, are you getting paid? Aren't you? What's happening here? Conditions in the plant. Are they really keeping 6 foot or more distance? What's happening with the line speeds? What's happening with protective equipment? And issues and problems with the sick or the family leave and the absences and that sort of thing. And what the committee is going to do is document where there are problems and where things need to change. Next slide, please. And this is now what you will probably have to do is build a campaign to get something fixed. So there's 4 steps for building an effective and speedy campaign. The first is research and information gathering. Do it quickly. Get reliable sources, conduct surveys, first-person accounts. Unions can put in information requests, identify examples of, you know, some actions that might be useful. The second is communicate and involve, communicate and involve workers and members. Right now, collect everyone's phone number, email address, set up phone trees, communication action teams, use social media listservs, and ensure that all communications are taking place in the languages and literacy levels of the coworkers and membership, and use this all to develop leadership. The third step is to develop your demands. Use your research and ideas from coworkers to decide what's your priorities, what do you want, when do you want it, and then identify some backup demands in case you can't win your initial demands right away. And the fourth step is to identify and exercise leverage. make a strategic plan for quickly winning demands, turn up the heat, and think in terms of worker involving strategies and escalating tactics, and identifying allies who can help. And that could be everything from, getting, somebody in the media, a politician, a community organization, a labor council, all of that. And can this work? All right, yes, it can. We're seeing it all the time. There was a literal walkout of unionized transit workers in Detroit. They won new cleaning procedures, hiring of additional staff, bus loading from the rear, no fare collection by the next day. Nurses who needed N95s and they were under lock and key and they weren't getting access to them. They took their breaks out in the break room and then told the bosses, as soon as we get our protective gear, we'll be out there. That got the whole system changed around so that the nurses themselves had access to the protective equipment. And then demonstrations outside grocery stores during the workday and other actions by grocery store workers have won. Plexiglass shields being installed between the cashier and customer, some protective equipment, and additional cleaning procedures. So this stuff is working.
And I want to end by saying we know it works because it is beginning to work right here close to home in Iowa. We clearly have had too many deaths, too many exposures and infections. And I think it's also clear that we have prevented exposures and deaths and infections because unions have taken action and workers have taken action. And in some cases, community organizations have taken action, including many of the groups who are sponsoring our webinar tonight. And I just want to note that the Iowa Federation of Labor in particular has been convening now weekly discussions where unions are exchanging examples of the challenges they're facing and the actions they are taking to get improvements in workplaces that range from construction sites to manufacturing to healthcare to post offices. And so people are learning from each other as examples and getting real improvements to occur when they can get groups of people together to take action. I want to note in particular that several of the sponsors of tonight's event, Team Can, our primary sponsor, is in the process of forming a brand new entity of union and community groups called the Iowa Council for Worker Safety. And that discussion is in progress and focused right now on how to begin building some local committees in meatpacking communities to take on some of the functions that we've talked about tonight. I want to pause here for questions and comments and ask people to think about or share your thoughts about right now next steps, both how we at the Labor Center can support your work, thoughts about ways that your organization might want to be involved in any of these efforts, and final questions that might be remaining for tonight.
So we have three questions. The first is, how does Trump's executive order impact the safety recommendations that we've provided?
You want to answer that, Nancy?
I can start it by saying there's an executive order that says that the facilities can't close down and they have to keep running and all kinds of things. But what we have found out is that that's not necessarily the case at all. That places have closed down as they should. And some people feel that the actual reason that they put the EO, the executive order in, is the last little piece that says that it protects liability of meatpacking facilities, saying that they can't be sued, and that was the real reason for that. But I think nothing that we've talked about is prevented by that executive order, and let the organizing and power building continue.
I would like to jump in for 1 second and make sure I wrap up the answer to the question we had in the last segment about what if your employer, you need leave because a family member has been exposed and so you're in a quarantining situation. The one thing I should have added and didn't was that people should also consider whether unemployment benefits are an option in our current context, because the eligibility rules have been expanded to accommodate a robust list of COVID-related absences, including the need to quarantine because of a known exposure, with the caveat, of course, that eligibility for those benefits can also be contingent on people's immigration status, and that it's not always straightforward who's going to be approved in that. But that is definitely something to pursue if you're only granted unpaid leave. It's worth applying.
So there's a question related to the examples of workers joining together and making a difference. But there are workers who are undocumented or are also afraid of speaking out. What can be done to support those workers?
Overcoming the fear of speaking out because you're doing it as part of a group in a strategic way that will mean we mutually protect each other is the only way workers have ever made progress. I think that's the first answer I would give. And that's why I think many organizations are in dialogue about how to create those kinds of relationships and networks that will make sure that people who speak up do it not as individuals who are vulnerable to retaliation, but will do it as part of a group of coworkers and community members who will support them.
And the last question is, how do we go about getting more involvement from minority populations in developing frameworks for how to respond to these issues?
Well, the first thing I want to say is that one of the conscious goals of the webinar tonight, and I want to again thank all the groups that sponsored and co-sponsored the event, because the intent was to try to share the first chunk of information, significant amount of information, thanks to Nancy, with organizations who are in very, very close touch with frontline workers on the ground. And that means workers from a very, very wide range of language groups and ethnicities and races. And the next step has to be that we begin directly convening groups who are representative of all those demographics. So that I know is a dialogue that is going on among many of the sponsors of tonight's event. And I really look forward to being part of those discussions in whatever way we can going forward.
We do not have any additional questions.
Nancy, do you have any final thoughts that you would like to add? And I want to close by thanking you so heartily again for joining us and for sharing your expertise both before and during, and I hope to count on after tonight. We're right at 8 o'clock, which is our end time, so perfect timing.
So I'll just say two things. One is we're going to make this path by walking it. There's no absolute blueprint for any of this. They talk about unprecedented times. So we make the path by walking it, and may the force be with you.
Thanks. And I'll share our Labor Center contact information one more time. If you registered for the webinar, we do have your email, and we will get a follow-up email out with links and resources, and that will also be your invitation to, of course, contact us with any additional questions that you didn't get to ask tonight. Thank you, everybody, for joining us, and thank you for the work you're already doing, and we look forward to partnership in the work that's ahead. Have a good night.